Greetings, and welcome to another edition of Community Chest. I'm your host, Felix Milan, and I want to welcome to the set today Elizabeth Sunzeri from the Heather Hills Therapy Center here in the Bay Area. Hi, Elizabeth.
Thank you
for being here
Good
today.
to be here. Thank you.
Tell us what the Heather Hills Therapy Center is.
Heather Hills Therapy Center provides support to the community. I'm a licensed marriage and family therapist, and so I do a lot of work with couples, and I do a lot of work with families. And I do something called cognitive behavioral stress management, and so it's kind of a connection with the mind and the body, and how much power we have with our mind to be able to affect things around us. And
So it's the marriage therapy portion of your business really has a lot of little tentacles that spread out and address many different things that affect marriage, affect a home.
They really do. It's kind of interesting because if somebody is depressed or if somebody has post-traumatic stress disorder, it does affect the whole family. So it's interesting because then I'm able to get family dynamics and the whole family involved. Sometimes I've actually had times when a mother has come to me with a child, and we've discovered that actually her childhood at about that age was very traumatic, and therefore she's having a hard time with her child at that same general age when she was affected. So it really does have an interesting.
It sounds fascinating, and I would love to be able to talk to you for a lengthy period of time on how the different types of people that come in and what their symptoms are and how all this ties in together. But one thing that really interested me was you provide a chronic pain class. Is that correct?
I do, yeah.
And I've learned that chronic pain is one of the highest incidences of ailments or maladies here on the in the Bay Area, on the south coast of Oregon. So that really fascinated me, and I wanted to learn more about chronic pain and these classes that you're holding.
And Felix, you're absolutely right. It is a big thing here in this geographical part of our country. And so I'm working with Bay Area Hospital to provide this. I'm doing this out of my own desire and on just my own time for fun. And what we want to do is help people understand and appreciate how much power they have with their physiological health in being able to control something like pain. And so we'll put on the workshop, and then actually I'm only one of many people who are involved. I'm kind of doing the pain management program right now, and it's done on the fourth Wednesday of every month, and it's a 2-hour segment when we get together. So we'll do a presentation and talk about the dynamics of the pain, and then we experience the relaxation as well. But there are other people involved too.
I see. So it's a collaborative.
It is a collaborative. Yes.
What is chronic pain?
Chronic pain would be something that would affect a person for a long period of time. I'm the exact, now there may be somebody in your audience who would know exactly what that is, and I think it's probably 6 months to a year, over 6 months to a year. Mm-hmm. So somebody could be having pain as a result of an injury or surgery, so you have injury pain or healing pain, but chronic pain goes on beyond that, and it's perpetually there. So fibromyalgia would be an example.
And what is that?
Fibromyalgia is a condition that affects people. We don't totally understand everything about it, but they have just numerous pain sites throughout their body that are affected, and it transpires over on an ongoing basis over a long period of time. I can't really. Which
used to be maybe called growing pains, or just getting older and you're getting creaks, and is that what that is?
That's very interesting. I like that. I think that might have been called growing pains and getting older. That might very well be. I'm wondering if there's more fibromyalgia now than we used to have a long time ago, and I don't know why, but why we would have more at this point, but I think it's something that's affecting, and it does affect women more than it affects men. So we have a lot of women.
Just like arthritis.
Mm-hmm.
Arthritis affects,
Mm-hmm.
yeah.
And lupus. There's an autoimmune piece somewhere in there.
I see. So if somebody came with you and was suffering from how did you say it? Excuse me?
Fibromyalgia.
What would you do? What would be your game plan, so to speak, to help this person?
Oh, well, one of the things I like to do is actually incorporate a program. So I use Dennis Turk's. I actually have his book with me. Just you have television, so you can see a copy of his book. I use his program on pain management, and he has a great section by section program that can be covered. And sometimes I cover it in fewer than 10 sections, but it's a wonderful program, and I pretty much follow it. It's cognitive behavioral, and then it gives practical things that people can do. I'm also involved in the cognitive behavioral stress management program that's based out of Florida, with some work that's being done by a health psychologist. But I've been working with Bonnie McGregor. Dr. Bonnie McGregor is up in Seattle, and she and I did a program up at the Hutch for 10 weeks with women who had the gene for breast cancer. So we presented this program to help them integrate cognitive behavioral stress management. This is cognitive behavioral stress management in its own, it's very similar. So that's kind of my specialty. And I would work with a person to know more about what's going on with their history of pain, and find out what some of their challenges are with it. But essentially, I would just take this program.
Mm-hmm. And 10 weeks, is that what you said, a 10-week course?
This is a 10-week program. Sometimes you can do it a little faster than 10 weeks. So, and insurances don't allow us always to have 10 sessions, so I try to go.
Is that frustrating?
A little bit, but it's also challenging to try to condense things so that we don't spend so much money on health care. I mean, that's good too, to be able, if you can do things more efficiently. That's good.
How long has Heather Hill's Therapy Center been in existence?
We've been in existence for over a decade. Started out a long time ago doing some work with children and horses, equine-assisted psychotherapy, and currently we're kind of gearing up for next year, being able to start that again. And I'm doing the pain management. I do a lot of work with PTSD. And we also utilize a program that's over the internet, so that somebody could click into the internet and get a cognitive behavioral program that's already set up and designed and known to be effective, and then provide that plus supportive therapy.
And that's on your website, I believe. Is that a portion of that? Isn't there
we talk about it on the website. Actually, we need to do an update because we have now, the company's name is Talaria up in Seattle, Washington, and they are now doing a pain management program. They're doing a PTSD program. I was involved in their research study with PTSD. Now we're starting a cognitive behavioral stress management program over the internet for women who have breast cancer.